All right, good morning. My name is Sarah Coleman, and you are here watching the Count the Kicks webinar for the state of West Virginia. So, these pictures that you see here today, these are baby saves that we have had through using our Count the Kicks program, and we're so excited to be able to bring this information to you today. So as I said, my name is Sarah Coleman. I'm the State Expansion Director here at Healthy Birthday Inc. Count the Kicks is an educational campaign that we use and refer to today. Our parent organization is Healthy Birthday. I've been with Healthy Birthday since March, and I'm excited to be the connection between our programming and then West Virginia, so our partners here in West Virginia. So I'd like to turn it over to Sarah Hybels, who's co-presenting with me today. Sarah, do you want to introduce yourself?
Sure, Sarah. Thank you. Hi, I'm Sarah Hybels. I'm the State Expansion Coordinator for Healthy Birthday and Count the Kicks. I've been with the organization about 7 months and have experience working in victim advocacy and the nonprofit world, and am passionate about maternal health care and serving infants. So I'm just so grateful to be here with you today to help you learn a little bit more about our program.
Awesome. Thank you, Sarah. And we also want to take a minute to acknowledge the Outreach Education Director for the West Virginia Perinatal Partnership, who is our funding partner in this state. That is Mary Beth Stewart. And Mary Beth Stewart joined us for our webinar on Wednesday. This is a re-recording. And so we just want to give her a shout out and thank her so much for being a part of this work. So as I said, West Virginia Perinatal Partnership is our funding partner, and we just want to acknowledge also the West Virginia Department of Health and Human Resources, Bureau for Public Health for also being a partner with us in our work. So we in our organization talk about baby saves all the time. We would love to be able to get a baby save in West Virginia very soon, but we'd like to introduce to you, this is baby Abel. Baby Abel is from Washington, and I want to share a little piece of his story. Christine, Abel's mom, shared with us. When Christine was pregnant, she decided to trust her intuition and contact medical providers when the fetal movement monitoring that she was doing was different than in previous days. In her words, she said, "I never truly thought such drastic intervention would ever be needed. Please pay attention to your baby's movements and bother the heck out of your medical team if something seems off." I'm so grateful to all the nurses and doctors that got Abel out safely, to Count the Kicks, and to those that share their baby stories. So again, we love to share these faces with you. This is the reason why we do the work that we do. So let's talk about how we can save babies in West Virginia together. There are 3 important hallmarks of Count the Kicks. Our programming provides education for expectant parents on the importance of fetal movement, and the campaign empowers those to speak up to providers if they have a concern. The best news for you as providers and health department workers, our campaign is ready to go. It's very plug and play. So this is Jen Hamilton, and we want to share with you a video that we woke up a few weeks ago to everybody talking about. Jen Hamilton is talking about Count the Kicks. We are so excited to see this. And she's going to give an overview of our Count the Kicks app and program. She's a labor and delivery nurse. If you don't know who Jen Hamilton is, she's a labor and delivery nurse from North Carolina. And she's not a Count the Kicks employee, but she is a strong advocate of fetal movement monitoring and the work that we can do together to save lives. So let's listen to what Jen has to say about our program.
Did you know that there's an app that can prevent stillbirth? Studies have shown that the most reliable indicator for an intrauterine fetal demise or stillbirth is a change or decrease in fetal movement. Getting to know your baby's movement and letting your doctor know if you have any changes is a great way to protect your baby. You don't need an at-home Doppler, and in fact, I would highly discourage you from buying one, because sometimes what happens is you can notice a change in your baby's movements and you can put on the Doppler and hear a heart rate and be like, whew, everything's fine. And if you were put on a monitor where we could see what your baby's doing, we would see fetal distress. This is a baby that's doing great. This is a baby that might not be doing great, and this is the baby that's definitely not doing great. But guess what? Every single one of them has a heart rate around 150. And with just hearing a Doppler, we don't know which one of these is your baby. There's a free app that you can download called Count the Kicks. It is a way that you can monitor your baby's movements, and it'll help you figure out if you might need to go get medical attention. I don't work for Count the Kicks. I get $0 for telling you about this. I just think that this is genius. They were able to decrease Iowa's stillbirth rate by 32% in the first 10 years of the Count the Kicks campaign. So please, take a few minutes each day and just pay attention to what your baby's doing. And if your baby's doing something wonky that they haven't normally done before, come see us. We would so much rather you come in, we monitor your baby, we maybe do an ultrasound, and we let you know that your baby's doing okay, than for you to not come in and your baby not be okay. You aren't bothering us, okay? We want you to come in. That's what we're here for.
Awesome. So we just love how much Jen gets in just 30 seconds talking about fetal movement monitoring and the importance of it. So I'm going to pass it over to Hybels, and Hybels is going to share some information with you.
Thanks, Sarah. So now let's talk a little bit about our proven evidence-based program, Count the Kicks. So we know that 95 babies are lost each year to stillbirth in West Virginia, and we believe that we can save 32 West Virginia babies every year with you implementing the Count the Kicks program into the work that you do with expectant parents. And now let's talk a little bit about the research and evidence behind using fetal movement monitoring as a best practice for stillbirth prevention. But first, please meet another baby saved. This is Mabel, and Mabel was saved because her mom, Megan, noticed a change in Mabel's movements and advocated for herself and her baby. Megan says the only red flag there was that was a problem with my pregnancy was my daughter's change in movements. I'm so grateful I had the concrete data from the app, which gave me the knowledge that something was off and the confidence to advocate for my baby. And we'll talk a little bit more about the app here in a few minutes, but just check out that sweet face. This is why we do the work that we do to bring more babies safely to their family.
So Count the Kicks emphasizes tracking fetal movements at the same time every day in the last trimester of every pregnancy. So again, I just want to highlight that again, the same time every day in the last trimester of every pregnancy. So we were published in the British Journal of Obstetrics and Gynecology in winter of 2023, and we've also been published in AJOG. If you're someone who really likes to get into the evidence, I encourage you to scan the QR codes that are here in the presentation that will be shared with you. The BJOG, as we refer to it in our organization, showed a 1% decrease in stillbirth rates across Iowa for every 3 months. And what they did is they compared us to other surrounding states. They looked at those rates and made that comparison. And the AJOG highlight is that expectant parents that were using our app and using the program, 77% of those expectant parents reported that this lowered their anxiety, and 84% indicated that this increased bonding. So we really want to make sure that we're talking about our research as a part of this campaign today. So you will see something referred to as the Norway study. In any training that you do with us, we come back to this. This is the hallmark study that kind of kicked things off for us. So our organization was founded by 5 women who endured the heartbreaking loss of their babies to stillbirth or right after delivery. And they dedicated their efforts to preventing this tragedy from happening to other families. They came across this study, and this set the stage for the Count the Kicks campaign. So some of the highlights are bulleted here on the slide, but the large takeaway is that the researchers found that the more an expectant parent was paying attention to movement and documenting what was normal for their baby, the better the outcomes for both mom and baby. So a campaign was born, and this began in Iowa in 2013. Oops, going back just one extra slide here. So here is some data about our Iowa campaign. This shows the life of the campaign. So 2008 is the inception of the educational materials. 2013 is when we launched our app. So you can see the trend line down from that date in 2003, where it starts, to 2008. You start to see that trend line come down. An important note is that compared to the United States, those rates remained relatively stagnant while Iowa's rate was decreasing. And we know that we can account for things that happen, fluctuations that happen in our year, things like the COVID pandemic or potentially a syphilis outbreak can have a huge impact, which is why we tend to look at longer term trend analysis. So the source of our information is the Iowa Department of Health and Human Services, as well as the CDC vital statistics. And we will include links in the slides that you get today. So taking a look at this chart, it's clear that there are vast differences in the stillbirth rate affecting Black, Indigenous, and Pacific Islander communities. So these disparities exist and they persist, and they need to be addressed through systematic change. When we think about other campaigns, public health campaigns that have been successful in reduction of rates, such as SIDS, one of the big differences here is that SIDS is a public health campaign that everyone hears about and can refer to, and that's called the Back to Sleep campaign. But it's less likely that stillbirth is talked about, even though stillbirth is, there's a higher incidence of reported death from stillbirth than there is from SIDS. We believe that that difference is due to individuals talking about this. So that is a barrier that we can, and a disparity that we can address through conversation. We'd love to make sure that everyone is as comfortable talking about fetal movement monitoring as they are with the Back to Sleep campaign. So as I mentioned, there's a large divide when it comes to those who are more likely to experience stillbirth. And I want to take a moment to share what research has shown to be some of the contributing factors. So as you can see here, there are several. This is not even all of them, but these are ones that we pull out and talk about with our state partners. One that I love to just call attention to, especially when we speak with providers and public health professionals, is the link of epigenetics. And we need to be talking about this a little bit more, the awareness of what we refer to as the life course theory. So knowing that early experiences, historical trauma, both positive and negative, can have this lifelong impact and can be passed along through generations. So environmental influences can definitely affect the expression of our genetic code. And these life experiences can really rearrange those epigenetic markers that govern gene expression. So this can be the perfect storm when we're talking about some of the disparities in birth outcomes. We as an organization want to really make sure that we have health equity at the center of our work. We have a health equity coordinator who is dedicated to reducing racial disparities that persist and helping us look at our materials, helping us look at our presentations, and really keeping equity in mind. So we've made some adjustments in the work that we do and the information that we share to reflect that equity, making sure that we're tackling things that we can have an impact on, such as technology. We have our kick counting bracelets. So if someone does not have access to the internet and they aren't able to use either our web or the web counter, the app or the web counter, this is another way that they can count. And some of these other things are just small examples of what we're doing. We know that stillbirth increases the risk of maternal morbidity by 4 times. So by doing this work, we are not only addressing the stillbirth rate, but also the maternal mortality crisis. And that's really important to us. Fetal monitoring can be a warning sign for preeclampsia, which affects Black women 60% more than their white counterparts. And so again, getting the word out about how important fetal monitoring is, especially because it's so easy to do, this is really important to us. So I'm going to pass it over to Hybels now, and we're going to talk about materials.
Great, thank you. So now we'd like to introduce you to our free Count the Kicks materials, and these are made free to providers in West Virginia, thanks to our partnership with the West Virginia Perinatal Partnership. We have posters, app cards, and brochures for you in English and Spanish. These are brightly colored materials that are easy to use and patient focused. We also have additional resources for you in West Virginia. We have magnets that are available for you to order, and online we also have printable kick counting charts. So go to our website, www.countthe.kicks.org, and order your free materials today. So now let's talk a little bit about why monitoring baby's movements are important and why movement may change when a baby's in distress. So movement is a really important way that baby communicates before birth. It's the change in baby's movements can be an early warning sign and sometimes the only warning sign that the baby is in distress. So just like when we're not feeling well, we slow down, babies are just the same. So think about when you have the flu or COVID or a cold, you're relying on the couch, we're laying in bed, we're not participating in our daily activity level, and babies are just the same. When we slow down, when we are not feeling well, we slow down and babies are the same. Babies' movements may become weaker because they're in distress, because they're preserving their blood flow to vital organs like the brain and heart to self-protect. So again, this change in movement can be the first and only warning sign that something is wrong with baby. So when should we start counting those fetal movements? ACOG recommends beginning counting at 28 weeks of gestation or at 26 weeks if considered high risk or carrying multiples, because this is when research indicates that baby has established a consistent movement pattern that can be tracked. And what movement should we be counting? We want to be counting those rolls, kicks, jabs, swishes, pushes, everything except for hiccups, because hiccups are involuntary movements. So we've talked about why it's important to track fetal movements, when to track, and what to track. So now let's talk about how to track those movements. And let me introduce you to our free Hallmark tool, our Count the Kicks app. Our app is free and in 16 languages and has been downloaded over 200,000 times. There are no advertisements or pop-ups to distract during a kick counting session. And we regularly survey our app users in order to make improvements and changes to our app. With our app, you can track for future pregnancies and track for multiples, and you can manage your account on multiple devices as well. So one day you could track on your phone, the next day your Apple Watch, the next day your web-based kick counter. So our goal for the app is we want the expectant parent to learn what is the normal movement pattern for their baby. We know that every baby is unique, every pregnancy is unique. So how long does it take that baby to get to 10 movements? Because we want that expectant parent to know what's normal for their baby and feel empowered to speak up if they notice a change. Our app is available on Apple and Android. And to start a kick counting session, you simply tap the blue footprint when you feel that first movement. The timer will begin. And every time you feel an additional movement, tap the blue footprint. After the 10th movement, the timer will stop. And if you are a registered user, that data will be downloaded to your account. So it's really important that everyone registers as a user. If you're interrupted during a kick counting session, you can restart the session or delete a kick if you accidentally track one. And you can also set a reminder through the app to count those kicks daily. So after a few days, you'll begin to see a pattern for that baby. Again, how long does it take that baby to get to 10 movements? You can review your history, download your history to share with a provider if you feel there's a concern, or share with a partner or family member. So we want you as providers to know about our app, to know how easy it is to use. So please download the app today, play around with it so you can show expectant parents how to easily use our Count the Kicks app. Another amazing feature we have for families is our Find Local Resources page on the app. So if you are a registered user, you can search by zip code for free and reduced cost services in your area, like shelter, food, childcare, diaper banks, and mental health services. This is just another amazing feature of our Count the Kicks app because we want families to be ready when baby arrives.
Let me come off mute there. So today we're giving you the tools to not just talk about stillbirth prevention, but to also provide information for patients and clients that meets them where they are. So by doing these 5 things that you see on your screen when you talk to patients and clients, you automatically increase their health literacy. So let's just highlight a few. The first is just to be equitable, avoid assumptions and provide all expectant parents, no matter the race, gender, religion, socioeconomic status, sexual orientation, marital status, or educational information. Make sure you're giving them the same information and same interaction. And we know that, just as a side note, higher education does not necessarily mean high health literacy rates. So even patients with high levels of literacy might have difficulty understanding health information and services. So think about the jargon that's used, the acronyms that are used in medical care. So listening and learning, I think the big takeaway here is to use open-ended questions. So instead of saying, is your baby moving? Say, tell me about your baby's movements. How is tracking your baby's movements going? That gets a little bit different response than just a yes or no, and can lead you as a provider or as a worker who's trying to listen and make adjustments to a care plan. That can just help you understand that a little bit better. So be clear and concise. And again, this goes back to that conversation about being equitable, avoid medical terminology, and use everyday vocabulary. So our materials, as Sarah was pointing out, we have the at a glance materials are very, very simplified, in that intentional. They have big graphics, and we're not using a lot of terminology. That is simplified for parents to use, so they get the gist of the program quite easily. Make sure that you're being honest. It's important. We talk about how pregnancy is full of risks, and we educate parents about that, but stillbirth tends to be the exception. So educating on kick counting and encouraging a parent to speak up will help ensure a parent with a concern contacts their provider. And then thinking about that reteach, if somebody displays confusion or a lack of understanding, or you heard like, oh, I just need to learn how to count with one baby, make sure that you correct and clarify, and just think about how, as a system, we're going to talk about system supports in 2 slides, but think about in your system, how are you connecting to resources, and how are you making sure that reteach happens where an individual's needs are met. So speaking of misconceptions and communication, we want to highlight 2 misconceptions here, but please feel free to visit our website for more information about misconceptions and stillbirth. And because we're recording this webinar today, this is often a time where we'd say, drop these in the chat and things that you've heard, because we like to collect these so that we can help you think about the way that you can respond. If you have some misconceptions that you've heard or would like some help with, feel free to email Sarah or I, and we will be happy to help you create some talking points about that. So back to the misconceptions. This is one that I heard in nursing school a long, long time ago. We'll just say it that way. That babies should get 10 kicks in 2 hours. So the thing about this is current research indicates that an expectant parent should work to understand the normal amount of time each day it takes their baby to get to 10 movements. And that's going to look different for every baby, for every pregnancy. This might be 10 minutes for me with one pregnancy, or it might be 25 minutes with a different pregnancy. And so again, respecting that each pregnancy, each baby is unique. And we need to find out what that normal is. So another misconception that we hear, if baby isn't moving, I should drink something cold or eat something sugary to get baby moving. Well, let's go back to why, Sarah was talking about movement is so important. If I have the flu and I just am sitting on my couch watching Netflix, I don't really want to move, I don't want to do anything, I may not want to eat, but you give me a Mountain Dew, I'll probably jump right off that couch after a little bit, once that caffeine and sugar kicks in, right? But that's an intervention. So kick counting is best monitored without intervention, such as juice or candy, etc. If a baby isn't moving like normal, people need to call their provider and talk through what the next step is. The provider is the one responsible for giving that the next step medically. So let's think about this from a systematic level. So thinking about providers, thinking about clinical practice, thinking about if you are a home visitor or a WIC clinic, or you're a public health advocate, how can you integrate Count the Kicks into your current system? So the first thing you can do is ensure that everyone on your team that you come in contact with knows. Maybe you're not a supervisor, maybe you're part of a team. Has your team heard about Count the Kicks? We've run into people in states where it's very uneven. Some teams know about Count the Kicks and other teams do not. So make sure that you're spreading the word inside of your team. The webinar is recorded. You got this recording today. Share it with the team members. Share it with individuals who you think would benefit. So think about paperwork, intake forms, action plans. Count the Kicks can be a part of all of that. If you have electronic health record systems and you want to see some after visit summary ideas, we have those. We can share with you hospital systems that have actually put this into the intake and the intake forms and share with you some different ideas about how to incorporate that. So I can't stress enough this third point, discuss at every parent contact in the third trimester. So you are providing education, but you're also encouraging and empowering parents to talk to their physicians about Count the Kicks. And then the last thing is share throughout the community. There are probably multiple times that you have personal contact with people in your community, expectant parents. Think about the school systems, physicians' offices are a big one, but school systems, libraries are a really great point. We've been seeing a lot more action. We've actually gotten emails from librarians asking to put this material in the library because people are coming in to check computers for job searches or school projects. They're bringing children in for story time. They're using their library as a resource center. So think about even that aspect. Where could you put this information? Those brightly colored posters look great on billboards that are available in grocery stores or just opportunities to share information. So another point that communication and getting the word out is our Count the Kicks ambassadors. So ambassadors are in many states across the United States, and most of them are women who are volunteers that are passionate advocates due to their own personal experiences. So the ambassadors can attend a variety of events such as medical conferences, community baby showers that are held. They're also available to give media interviews. Sometimes they'll talk about their own experience, or sometimes they'll talk about the campaign, but they are available for media interviews at the local level. You have an opportunity, if I'm going to advance my slide here. This is Christy, and Christy is the West Virginia ambassador whose son Garrett was born still of 2014. And I'll just share this part. Christy's not with us today, but I'll just share her story with you. She said, after experiencing a very easy pregnancy, I was stunned to learn that my son had passed away at 35 weeks gestation. Nothing can ever prepare you for the moment that your life forever changes. During an online search in the spring of 2014, I found the Count the Kicks website. I knew immediately that this is something I wanted to be a part of. Less than 2 weeks later, I was on a flight from Des Moines to attend their Every Woman Counts events and become a trained ambassador. That trip changed my life. I met amazing women who had experienced the same loss that I had. These women were able to turn a horrific experience into a celebration of their child's life and a positive message to save other children. I quickly formed a deep bond with many of these ladies. I was inspired to return home to West Virginia and begin sharing the message in my area. I have so many personal goals for my Count the Kicks work. I especially enjoy talking with expectant moms about the importance of tracking babies' movements. So many local providers and parents have expressed positive feedback about our message. I feel a renewed sense of purpose for my life. It is a privilege to share the Count the Kicks message in honor of my son, Garrett. And so we just want to thank Christy for her work with us. It's really important that we honor Garrett's memory and encourage you to think about him today.
Now I'd like to introduce you through video to Dana and baby Save Nala and their beautiful story about how Nala was saved after Dana noticed a change in her baby's movements and felt empowered to speak up to her care provider.
She came back in after she had me put on the monitor and stuff, and she's like, we're just gonna take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. Well, I basically learned from the doctor's office, the little yellow sign that was right there. Once she started moving, I was was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention and count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously. Like, it's your baby's life.
All right. So we are thankful that you were able to join us today. Here are some additional resources for you. Our social media manager is very active. Our Healthy Birthday accounts focus on advocacy work and some of the initiatives that we are focused on. And then our Count the Kicks is a little more parent facing. And so there's a lot of educational pieces, short snippets. Morgan's very good at what she does. We have a newsletter that we would encourage you to sign up for to follow along with us to hear about updates. And so that QR code is there. And at this time, we say thank you for joining us today for the redo of this webinar. And please email us if you have any questions. Bye-bye.